be with Deputy Attorney General a few weeks ago, and I said, are you going to, and she wasn't even aware, so it hadn't filtered down to the Attorney General's office, who is the group that is going to prosecute psychologists for not dealing with this issue properly. She hadn't heard yet. So I told her that what had happened, and I said, would you prosecute? So if you heard that a psychologist knew that his or her patient had viewed child pornography, would you prosecute somebody in that situation? And she said, absolutely. I mean, with no hesitation. She had not thought about this issue. There is no question I will prosecute a psychologist for doing this. And then she paused a minute and said, and by the way, I want you to know I'm talking more as a mother of two girls as opposed to a Deputy Attorney General. But in my role as Deputy Attorney General, I'm going to prosecute psychologists who are not reporting this properly. Might be interested to know the reason I was there. The Attorney General's office, who is the one who prosecutes psychologists, mental health professionals for not behaving themselves, for doing naughty things. They started a new process, which I think mostly is very positive, out of fairness to psychologists so that their licenses don't get revoked unnecessarily. They hire a psychologist, in this case it was me, to listen to the psychologist being accused of something unacceptable and make a recommendation whether the license should be revoked or not. So in this case, it was a very interesting case where a woman psychologist was accused of giving cocaine to one of her patients and then having sex with him. Those are two fairly serious behaviors, both of which by itself you will lose your license if you were found to have done that. And it turned out that, so I went into this thinking this woman is a dead duck, and it turned out she may or may not be a dead duck, because, I'll tell you one quick aside and then I'll stop. So she was a terrible witness. She really seemed very unsophisticated from a psychological point of view. And she didn't know she was there because she was accused of giving cocaine and crystal to a patient and having sex with him. When the Attorney General finally got to this, was, by the way, 12 hours into 2 meetings, 12 hours of meeting, says, you want to know why you're here and what you're being accused of? And she says, yes. And the Attorney General says, because you have been accused of giving person so-and-so crystal and some cocaine. He says, absolutely not. I've never used those drugs. I don't have it. I wouldn't even know how to. So there's that issue that we have to address. But the sex issue, she had her only smart question was the following. Did you happen to ask, and he said, I had no physical contact with him except that I hugged him once before he was going to a treatment program out of town, and it was from the side, and his mother was present. Okay, so that's one answer. And so here's her smart question, was, did you happen to ask this person, my former patient, whether when we had sex, did he see me undressed? Which is mostly what happens when you're having sex with someone. So she said, yes, as a matter of fact, we asked, did you see her undressed? And said, did you ask him, is there anything unusual about my body? He says, yes, we did ask. So they were really quite thorough about this. And he said, oh no, our body is beautiful, it's warm, it's luscious, and went on and on and on. And she said, okay, can we take a 5-minute break? I want to go outside with my attorney. So the Attorney General, who's a woman, says, yes, you can go outside. Comes back and the attorney says, can I talk for my client? There are some things about her body I want to talk about. Is that acceptable? And that he told the Attorney General that there was nothing unusual about her body got quite a stir out of her. She said, there are several very unusual things about my body. And then specifies part of one breast is missing, She has scars from cigarette burns on her upper thigh that she says are repulsive. If somebody could see me undressed, they would not think that is a very warm, loving, whatever his words were. And then the other thing, on top of all of those things, is my back is one large tattoo. So when he said there's nothing noticeable about her body, he missed apparently those 4 things, which potentially will save her license. So the Attorney General, who at that point will be making a decision, it will be her decision whether to move forward to go to court and revoke her license, I think was quite convinced about that statement that maybe there's something about what we're hearing from this male patient that was not legitimate. On that happy note, anybody else have any questions? Okay.
Hey, thank you, Steve.
You're welcome.